As we enter a level of unemployment not seen since the Great Depression, some health experts say one of the solutions to the crisis could be a modern twist on how FDR lifted the U.S. out of the Great Depression.
The Hill's correspondent Reid Wilson wrote about a program that was launched in Massachusetts, which employs people as coronavirus contact tracers. It's a WPA-like initiative that marries an economic and medical response and could actually end the crisis quicker and help the economy. But could it be implemented nationally? Reid joins us now via Skype with more on this. Reid, I'm so glad you've been reporting on this because it's an idea that I've been floating here as well, because while much of our economy is shut down, there are certain specific areas where actually we need a surge of workers. So it makes a lot of sense. Talk to us first about what Massachusetts is doing.
Massachusetts has partnered with a group called Partners in Health. They're a global public health nonprofit, and they're sending out about 1,000 people to trace the contacts of those who have come down with the coronavirus. Contact tracing is a fundamental building block of how this all works, how the public health system operates. And what the goal is basically to form a ring around those who have the virus so that we know who they have been in contact with, so that if one of those people comes down with the virus, you can get them in treatment really quickly and they won't spread the virus even further. This is the absolute ground zero building block of what successful public health looks like. Developing countries do this really well. We tend to underinvest because we invest more in hospitals and medicine and things like that. But if we do these sort of fundamental building blocks here, it's a way to squelch the virus and potentially to build a lot of jobs in the future. The amount of money that the Roosevelt administration spent on programs like the Civilian Conservation Corps, the Works Progress Administration, was about 6.7% of GDP. Extrapolate that to today's dollars, and that's actually less than what Congress just spent on the relief package.
Right, yeah, that's a great point. Reid, so outside of contract tracing, what are some other areas where we could expand this into a jobs program that also meets the needs of our public health? What are some other areas that public health experts say we need the general public's help and possibly the government's assistance in employing in these key sectors? What do we need right now?
Well, we need people to take their own responsibility seriously. We're not like China. We can't lock people into their houses and force quarantine on them. But what we can do is try to convince people to stay at home voluntarily, limit all of their social contacts. And we're actually seeing a lot of cooperation in the sort of general populace, more so than even the federal government anticipated. So good job, all of us. Another way that we can all get back to some kind of work is to do some of what China did, which is to take people who don't necessarily have medical training and train them in some small aspect of the response, where it might be teaching people how to properly put on and take off personal protective equipment or something like that. It's something very simple that you can train people to do in a day, and then they can help with the response. Not everybody has to be a trained PhD epidemiologist to get this right, but everybody can help in their own small way. What we need, though, is to scale this up at a broader level.
Yeah, well, and by citizens getting trained up for some of these basic tasks, you could actually free up some healthcare workers for higher level tasks as well. I think it's worth pointing out, Massachusetts has a Republican governor, so this isn't like some liberal lefty, left-wing idea. This obviously found some bipartisan support in Massachusetts. Has it been popular there thus far? And has there been any interest that you've seen in scaling it nationally? Have any of the folks here in Washington taken a look?
Well, it's only just gotten started, so we don't really know if it's terribly popular or not. But the good news is these are people from the local community. We're at a point right now in America where we don't trust our federal government very much. We barely trust our state government, but we do trust our local government and people in our own community. So if we're employing thousands of contact tracers around the country, where are they going to come from? They're going to come from next door or down the street or down the block. And they're going to be your friends and neighbors who are doing these contact tracings. That is what is going to make this a success if we do that at the local level and if we make this something that a community can actually get involved in. One of the things that's actually heartened me about this outbreak is how much we're seeing neighbors helping neighbors. And if we keep doing that and scale it up, then not only can we bend the curve, but hey, maybe we can have a long-term positive impact here and bring ourselves together a little bit more.
Certainly, Reid. Well, thank you so much for joining us and for the update. Stay safe. We appreciate it.
Thanks, Reid.
See ya.
See you later.
And we'll have more Rising for you after this.